Let's talk about tethered areola scars. And this can happen, like you said, after an explant, but it also can happen with an implant in. So the incision underneath the areola can be quite problematic, and it's decently common that we see it not smooth, but we see it sunken in. And when you go through that incision, there's a couple different layers. You have the skin, you have the fatty tissue and breast tissue, the capsule and muscle. And what often happens is the fatty tissue and breast tissue doesn't heal well together, and the skin can tether down to the capsule. Now, with the implant in, sometimes that fatty tissue and breast tissue didn't heal well, but you don't notice it as much until the implant comes out. And the reason why is the implant is rounded and tents everything out. And it also stretches and thins the tissue. And with it being like that for years, the breast tissue and fatty tissue can actually retract. So it's not just right there together, it didn't heal well, but it's still in the right spot. It actually pulls apart with time. So what happens is once the implant's out, that becomes really obvious, and you can see that you just don't have enough tissue there. The tissue thickness is like this, and then under the incision it's like this, and then it goes like this again. So in the operating room, we always try to advance that tissue and get the area closed, but that can be complicated slash impossible sometimes depending on the situation. The other option is in the operating room is to do fat grafting at the time of surgery. And this is hard to do if you're using that incision. But if you're not using that incision and you're using like an IMF incision, we can often fat graft at the time of surgery and make that better. Now, say you're after surgery, and this is true for explants or for a breast augmentation that goes through that incision, although please don't use that incision for breast augmentations anymore. If you do have tethering of that incision after an explant or after a breast augmentation, typically the first thing I do is wait till people are initially healed and then start cupping. So the most firm scar tissue is in the first 6 weeks, so you're not going to make much progress during that time period anyway. But as the scar tissue remodels and softens, you can use these cupping devices, and your surgeon can send you to the website to buy them and pull on the area and stretch it and try to prevent it from tethering back down. That area, if it's been tethered for years with the implant, sometimes it will have a memory and try to go back even if your surgeon repaired it well. Often patients don't even know it's tethered because it's at the underside of the breast, and when they look down, they don't see it. And all of a sudden with the implant out, they see it and they think it's new, but it's actually been there. So cupping is often my first option. Now, when I have patients cup for a while and I'm not getting anywhere, or I think I do need tissue in the area, the first option is always to put something there. And fat grafting can be an option, and that can be done in the office and doesn't require a full surgery if you're just doing a tiny area like that. But you can actually use filler in that area too. You just have to remember that fillers are not permanent, and fat potentially is permanent. So if you're using filler, you're going to have to redo that from time to time. I would not recommend Sculptra, and I know some people use Sculptra, but it is unclear how Sculptra affects your mammography. And breasts make cancers, and you always want to be thinking about how is this going to affect my future mammograms. I wouldn't use Sculptra. Now, I've seen some people do other creative things like use little wads of mesh or dermal matrix in the area. So if it doesn't work, if you just can't get the area plumped up with fat grafting or filler or cupping, they'll take a small piece of dissolvable mesh or a small piece of dermal matrix, fold it up in a little square or rectangle, open the incision up, put it under the skin, and then close things up. So you can add a little bit more tissue and hopefully prevent it from sticking back down. Now, this can be problematic because it feels like a little wad of stuff there, and a lot of patients are bothered by it, but it certainly is an option too. So that's the basics on how to handle a tethered areola scar. This is such a nuisance to both surgeons and patients.